various factors which are affecting the drug action, or we call it as a factor influencing drug action. And there were various factors we have seen: physiological factor, pathological factors, then drug related factors. And in that we were about we have seen these all various adverse reactions: A, B, C, D, E, F, E type. Up to E type we have seen, and up to E type they are there, we have classified them. Then how allergy is treated. So the offending drug must be immediately stopped. If the reactions are mild, like skin rashes, etc., then they will subside by themselves and do not require antihistaminic agents. They are beneficial in some of the type 1 reactions where urticaria, rhinitis, swelling of lips, etc., are the sign, and skin rashes are there. In that we can use antihistaminics. So what are other agents we are using in allergy depending on the type of allergy? Anaphylactic means the first type of category, IgE mediated. So if it is shock or angioedema of larynx, of the Resuscitation Council of UK has recommended following measures: put the patient in reclining position, administer oxygen at high flow rate, perform cardiopulmonary resuscitation if required. Adrenaline is used. Why adrenaline is used? Because adrenaline, we have seen, is a physiological antagonist. Physiological antagonist means actually there is no such thing like physiological antagonist. It is just for concept it is made, that physiologically when they are having actions opposite to each other, so therefore we cannot call as a physiological antagonist, because we know that basic mechanism or basic definition of antagonism involves what? That they don't have intrinsic activity. Here adrenaline is also having intrinsic activity and histamine is also having intrinsic activity. So technically they are not antagonists, but just for the sake of understanding, people say that yes, adrenaline and histamine are physiological antagonists. So what do you mean by physiological antagonists? That they have exactly opposite action to each other at certain places, at certain points, not every places, and therefore adrenaline is used because histamine is involved in the allergic reaction. Repeat it every 5 to 10 minutes in case patient does not improve or there is an improvement in the is transient, and it is only the life-saving measure in these cases. The adrenaline should not be injected intravenously, because itself it can be fatal unless shock is immediately life-threatening. Adrenaline injected, it should be dilated to 1:10,000 or 1:1 lakh units and infused slowly with constant monitoring. Administered H1 antihistaminic agent like chlorpheniramine, etc. There are many like that. Give it by intramuscularly or slow IVly, and it may have some help into it. Intravenous glucocorticoids can also be added. Particularly they can helpful in the type 2, type 3 and type 4 reactions. Now next type of adverse effect is called as a photosensitivity. It is a cutaneous reaction resulting from drug-induced sensitization of skin to UV radiation. Phototoxic drug or its metabolite, they accumulate in the skin, absorb the light and undergoes a photochemical reaction, resulting into a tissue damage, a sunburn like situation they produce, and therefore there is erythema, that is swelling and redness, edema, that is swelling, blistering, that is boils are there filled with water, so blisters will be there, followed by hyperpigmentation, coloration of that area, dark coloration, and discoloration, that is removal of upper layer or just scratch like situation. The shorter wavelength UVB response are responsible for this. Drug involved in the acute phototoxic reactions are tetracycline, particularly dimeclocycline, and some tar products. They are causing photosensitivity. Then photoallergic or drugs or its metabolite induces cell-mediated immune response, which often exposure to light of longer wavelength, that is 320 to 400 nanometer, or we call it as a UVA range. It produces a papular or eczymatic contact dermatitis like picture, and these are the drugs like sulfonamide, sulfonylureas, griseofulvin, chloroquine, chlorpromazine, etc. So these drugs are responsible for photoallergic type of reaction. Then next type of category of problem is called as a drug dependence. There are three kind of drug dependence: psychological dependence, physical dependence, and drug abuse. Now this is we have seen as a adverse effect, E type of or last type of adverse effect, that is when the drug is withdrawn. So what happens into it? So in that what happens is there is a dependence, means without drug the body cannot do the things, and because of that since body is remaining dependent on it, if the drug is not there, body shows reaction against it, and that causes a bigger side effect. So there are many such drugs which are causing different kind of dependence. The easiest example, if you want to take or test the example of dependence, those who are having habit of tea or coffee, and they need it at that time, you just keep the time and you see what happens. Okay, there are many those who forget. Same is the case those who are habituated with the smoking. If they do not take adequate amount that particular time smoking, or tobacco chewing, or alcohol after some time. Alcohol initially it is not causing dependence. So there are many such agents. Then in latter one or higher one are various drugs of abuse. They are called as like heroin, morphine, cocaine, etc. There are many such, methamphetamine. There are many such drugs which are responsible for this kind of drug dependence. So these drugs which are causing dependence, and once they are taken, all are not taken for some pharmacological purpose. Okay, if it is taken for pharmacological purpose, then it's fine. Example, morphine is taken for pharmacological purpose as a painkiller. Then we can have plan about it. We have to use it. But other things are not required, and still if they are used, then in that cases this is called as a drug abuse. That without any use, without any requirement, if somebody is taking the drug, that is called as a drug abuse. So this abuse is again dangerous because it is not required. We have seen every drug is a toxic. Okay, every drug is having there is a very good quote by Paracelsus, a physicist was there in 18th century. So he told that every drug is a poison, every chemical is a poison, everything is poison. He told that, but only matters is what dose. That is example, he says that even glucose can be poisonous, because or sugar can be poisonous. How sugar can be poisonous? If you take it in very high amount, then sugar itself is also poisonous. Okay. So if somebody takes salt in very high amount, salt itself can be poisonous. Only thing is there are something which are having low dose, some are having high dose. So dose is important. So drug abuse is why problematic, that unnecessarily that dose is going into body, it stays in body, and there is no need just for the pleasure people are taking. So may it be alcohol, may it be heroin, may it be cocaine, may it be any kind of such drugs, they are called as substances of drug abuse, and they all are having problems. So they are responsible for causing psychological or physical dependence. Psychological means mental craving is there. Mental craving means if it is not there, the person will behave like a psychiatric person, that without that cannot do, will do anything for that. And there are physical dependence means the body will crave for it, and there will be either pain in body, vomiting, and like that situations are there. That is called as a physical dependence. So this kind of drug dependence is there. Those drugs which are causing dependence, they are dangerous. We have seen one example earlier also, glucocorticoids. They are used for various treatments. They are one of the very good agents in many cases. But if it is used continuously, then always their dose has to be tapered. That is slowly. If it was earlier 10 milligram, per day, then slowly you have to reduce it to 8 milligram. After 8 milligram, you have to reduce it to 6 milligram or 4 milligram, and then slowly you have to stop down. Otherwise, it can cause problems. We have seen what kind of problem that is. It will change the hypothalamus pituitary adrenal cortex HPA axis. It will be modifying, and because of that, many problems can be there. So these are what problems which are associated with the drug, and therefore all these drugs, once we are aware about it, then we should be making that all kind of cautions with us, and this caution should be used so that we are whatsoever patient is there, we are not putting into suffering, because patient is not knowing anything. The either doctors or the pharmacists who are aware about drugs, they are it is their responsibility to know everything about drug and accordingly prescribe with maximum safety to the drug to the person. Then next is a drug interaction. So it is the modification of the effect of one drug by the prior or concomitant administration of another one, that is called as a precipitant drug. So one is object drug and other is precipitant drug. So when two drugs are there, we call it as a concomitant. Normally simultaneous word is not used, because simultaneous means two tablets simultaneously. But concomitant means maybe one is taken in the morning but it is in the body, and other is taken in the afternoon. So first one already in body, then it will cause the problem, that is called as a concomitant administration. Okay, when the first drug is still in the body and the second drug is entering the body, and now both drug will be available in body, so that will call as a concomitant administration. Now in that cases, I have already explained you about this, that there can be interactions. There are two drugs which are competing for they are competing for, just a minute. Yes, so it can be anything like that. It can be pharmacokinetic or pharmacodynamic. That is what it can be, involving effect of drug on either absorption, distribution, metabolism, excretion. We have seen examples of that. If there are two drugs which are having competing for the same absorption site, I have given you example that there is a border, and on border single gate is there, drug A and drug B are coming. So there will be chance that normally without B, if it is there, there are 10 A are going or 10 B are going. When both are coming together, so either some of the A will be left behind or some of the B will be left behind, and that means that will be affecting. Same is the case of distribution, protein binding. Some will be displaced from the protein, and therefore their protein binding will be changed, they are reduced. Same is the case in the metabolism. If you remember, we have seen enzyme induction and enzyme inhibition, and same is the case with the excretion. So there are a variety of drugs which are causing direct or indirect. Okay, this you will have this chapter later, and therefore I am not going in detail now, but this will help you to understand what do you mean by various drug interaction. Pharmacodynamics, we have already seen this, that is called as synergism, antagonism, alter cellular transport effect on the receptor side, change in the impact, and this is what these are various mechanisms of drug actions. What are the outcomes of the drug interaction? So it can cause either loss of therapeutic effect. So either drug A or drug B, when given together, either it will be loss of therapeutic effect of one or both. So if it is loss of therapeutic effect, then it is useless. Patient is unnecessarily, or doctor is unnecessarily in impression that the treatment is given, and therefore this will cause benefit, but it is not causing. Those who are aware about interactions should be avoid the interaction. Then it can cause toxicity. Toxicity can be in any form. It can be unexpected increase in pharmacological activity. So if it is pharmacological activity increase in within limit, it is okay, it can be beneficial. But if it is not in the limits of pharmacological activity and it has crossed it to the toxic level, then it will cause toxicity, and because of that again patient will be having a problem. Beneficial effects are there uh, because we have seen that when two drugs are added, we can see them as a additive or potentiation, that is synergistic effects. So they are intended are there, or there can be antagonism also, and antagonism can be intended only sometimes. Chemically or physical interactions can be there. Normally we do not call it as an interaction. Anything which occurs outside the body, we do not call it as a drug interaction, because it is what we call it as a incompatibility. If you have studied it in a dispensing pharmacy, we call it as a incompatibility. So intravenous incompatibility in fluid or syringe mixtures, these are the type of interactions. But then incompatibility that way is not actually drug interaction, because it is outside the body. So these are various pharmacodynamic interactions. Excessive sedation it can cause, then respiratory depressions, motor incoordination due to concurrent administration of benzodiazepine, a sedating agent, and along with that benzodiazepine is a hypnotic sedative drug, and along with the histamine, which is example is promethazine, which is sedating, or a neuroleptic agent like chlorpromazine or morphine, or drinking alcohol. So when benzodiazepine is taken with that, it can cause excessive sedation. Then there can be fall in blood pressure and fainting due to concurrent administration of alpha-1 adrenergic blockers, plus and along with that vasodilators or AC inhibitors, high ceiling diuretics, and cardiac depressant. Let me tell you, you should not get confused in the second one, because you will find, I told you about these memes and sims. You can see, you can download it from Play Store. You can put in your mobile, and 1mg is another app. So sims, memes, they will show you. Now you should not get confused that concurrent administration will cause fall in BP and therefore they are not used at all. You will find that there are many agents, they are actually combined together. But then when they are combined together, then in that cases their doses are reduced. They are added to have a synergistic effect. So if it goes beyond, then BP is an extension, fall in a BP is an extension of action, is a type 1 type of reaction, or type A type of adverse reaction. If blood pressure falls, then it can cause decrease in the blood supply, and because of that there will be fainting. Now this is what happening. Why it is happening? Because the drug has beyond activity, whatsoever activity expected. Suppose blood pressure was high, around 160, and by chance 2 medications of this range are prescribed, and it has come down to 100, which is less than 120. Then in that case, yes, the person may experience problems up to fainting. If it still goes down, then there can be fainting. Why? Because two are acting synergistically, and it was not taken into account. So it has to be taken into account that two drugs can cause synergistic reaction, and because of that, in that cases the drug should be, the dose should be reduced of this drug, then they can be combined. So it is not that they are but there are some interaction where this combination are totally banned. They are not at all allowed, and that much detail I am not telling you now, because you are not aware about these drugs. You are not aware about any kind of details about the drug, where they are used, and therefore it's better that once you study it, it will be there in 5th year, but this basis will be helping you to understand the concept when you will be studying that topic in 5th year. And also during pharmacology of 2nd year and 3rd year, whenever there will be thing that there is a drug interaction. So in pharmacology, in monograph it will come like that, a brief information about drug, including brief history, then mechanism of action, then pharmacokinetics, First pharmacokinetics, then pharmacodynamics is and effect on various tissues if it is there. If there are multiple tissues, mechanism of action, pharmacokinetics, pharmacodynamics, that is action effect on various tissues, and then what are the uses, what is the dose, what are the toxicities, in which condition it is not used, we call it as a contraindications. Indications means where it is used, contraindication means where it is not used, okay, or it should not be used. Special precaution means in what conditions, suppose if it is younger cases or pregnancies or older cases, then what care has to be taken, this is coming as a special precaution or caution, okay. And then there can be drug interactions in that only, or in special corner or warnings it will be there, should not be taken with this or this kind of drug, otherwise it will cause. So that is coming under all monographs or all the drugs details or pharmacology of each drug, you will find this. So this is why we are studying this various interactions, so that whenever it comes we are aware about it. So there are many such pharmacodynamic interactions, like hypoglycemia can be occur when propranolol is administered to diabetes having insulin sulfonylurea because blockage of beta adrenoreceptors. There is increase of risk of bleeding due to concurrent use of antiplatelet drugs like aspirin, clopidogrel. Again, these are given in combination. Okay, at many cases they are given in combination. Few more examples are there, like hyperkalemia by ACE inhibitors and potassium sparing ototoxicity because of aminoglycoside antibiotic in patient receiving furosemide, antagonism of bacterial action of beta-lactam antibiotic by combining with bacteriostatic drug like tetracycline, erythromycin, clindamycin, etc. So these are such variety of type of interactions are there, which should be known to the persons who are prescribing, and because of that they can take care that to avoid it, so that patient is benefited or patient is not unduly suffering from the problem. So again, these are interaction before administrations, what we call it as a incompatibility. I will not go into more detail about incompatibility, because incompatibility is again a different thing. That is a chemical reaction is there between two drugs which is outside. It is neither pharmacokinetic nor pharmacodynamic, okay. But as a pharmacist one should be aware about it, so that if the two drugs are getting mixed they will not allow, okay. Then next is these are pharmacokinetic type of there, which are causing the severe reactions. Some of the pharmacodynamic, and some of these are dangerous one. Then next thing is a very important concept in pharmacotherapeutics. You will have this year only you will have some better idea about this, that is called as a fixed dose ratio combination preparation. They are very popularly called as a FDCs, fixed dose combination or fixed dose ratio combination preparations. Those who are interested to have more knowledge about it, they just put in Google search fixed dose combination India, and they will come to know about the recent happenings which were there. Indian government tried to ban around 500 such fixed dose combination, which one expert committee thought that they are not of use, they cannot, or rather they are causing more harm than benefit, and pharmaceutical companies, they are just continuing this kind of fixed dose combination for their own profit, or just doctors are prescribing because they are not aware that this can happen. So a lot of things were going about this fixed dose combination, Now, what are the situation about it? What is important about it? What are the advantages? It is convenience, that there are two tablets taking, instead of taking two tablets, when it is combined, only one tablet will have to be taken. This is called as a fixed dose combination. Okay. Then certain drug combination are synergistic. There are many such synergistic combinations are available, and they are usually always they are given in that combination. Example of this is an antibacterial agent sulfamethoxazole and trimethoprim. Usually they are always combined. Then levodopa and carbidopa, or levodopa and benserazide, they are always combined. Then oral contraceptive are available in contraceptives. So they are always combined because they are synergistic, it is known, and therefore it is better that dose of both drug is reduced. Then therapeutic effect of two components being same may add up, while side effects being different, and therefore there will be comparatively less side effects. Example, amlodipine and atenolol, they are combined as an antihypertensive. I told you about it, that earlier we have seen that they can cause marked hypotension. But if we reduce the dose of amlodipine and reduce the dose of atenolol, because of that, what will happen? We are giving the drug in less dose. If we know about the role of plasma concentration, if dose is less, plasma concentration is less. If plasma concentration is less, it will not accumulate. If it is not accumulating, it will not cross the toxic level. So if it is not crossing toxic level, that means that it will cause less adverse effects. And therefore both drug if we can give. And second thing is, each drug may not have same adverse effect. So amlodipine may have some adverse effect, atenolol may have some other side effects. If I am not combining, then I have to give amlodipine in double dose, so all the side effects of amlodipine can be there. Or atenolol I have to give in higher dose, again there can be adverse effect. And if I combine amlodipine and atenolol, then I can reduce the adverse effect of amlodipine and atenolol. The side effect of one component may be counteracted by the other. Example, a thiazide is a diuretic which causes loss of potassium, and because of that it changes the fluid electrolyte balance of the body. It can cause hypokalemia. Now there is another diuretic which causes pairing of potassium, means it will not allow potassium to be excreted, and because of that, diuretic are the agents which are causing increase in the urine formation and urine excretion. So in urine, if more potassium is excreted out, then body will have less potassium, that is called as a hypokalemia. And if we use potassium sparing diuretic, then it will balance this, and we can reduce the dose of both, and therefore again we will have less adverse effects and more benefits. Then next in that is combined formulations. They ensure that single drug will not be administered. Particularly in certain cases, it is highly recommended, it is rather mandatory not to administer only single drug. Example of these cases are tuberculosis, because tuberculosis bacteria is so dangerous that when only one drug is used, then it can form resistance against it. Or same are the case of HIV AIDS virus. So in that cases, the virus can cause, or virus will form the resistance against it, and therefore it can be very dangerous if only one drug is there. And therefore it is compulsorily the combination has to be given. So thus it will ensure that single drug will not be administered, and if the single drug is not administered, the chances of the problem associated with the single drugs will not be there. So these are some of the benefits or advantages when we are having fixed dose combination preparations. Then next is, what are the disadvantages of it? The patient may not actually need all the drug which are present in the combination. It is very, very important, and therefore as I told you, those who are interested in better knowledge can search, Google search, and type it fixed dose combination, and India, various regulations for that. So recently what was happened, then people went to court and they requested court that it is going to harm everyone, therefore it should be continued. So there are many such preparations. Example of that is Vicks tablet, etc. Common cold tablet. There are many drugs are added into it, or common cough syrups, etc. So there are many drugs which are added into it, and because of many drugs which are added into it, we know that more are the drug, more are the chances of side effect of each and every drug. So patient may not actually need all the drugs present in the combination, and therefore patient is subjected to additional side effects and expenses, because if the drugs are added, then definitely their cost is added. So unnecessarily we are getting, there is one science you will be getting, one field you will be getting, that is called as a pharmacoeconomics. That means the treatment cost is also important. You should be also aware about treatment costs. So when the drug is not needed, then and if it is administered, then what are involved in that? The cost of drug is involved, adverse effects are involved. The cost of adverse effect is involved, because if the patient suffer, cannot work properly, and therefore all these costs they are involved. The dose of most drugs need to be adjusted and individualized. When a combined formulation is used, it cannot be done without altering the dose of other compounds. Example, there are two drugs, we know that they are needed, but then, and we know that in that, as per our need, drug A dose should be 50, drug B 50 milligram, and drug B dose should be 25 milligram. But now if the combination is available as 60-30 or 40-30, okay, then it means that we cannot have the liberty to use the dose which we desire. Whatsoever fixed dose is available, that dose has to be used, okay, and therefore that is the problem which is occurring in case of this fixed dose combination. Then second thing is the time course of action of the components may different. We know about pharmacokinetics. What we know pharmacokinetics, that drug is absorbed, okay, then let us assume that both are having different mechanism of absorption, or they are not interfering, okay, then they are metabolized. Then again, suppose metabolism is different, no problem. Third one is after they are distributed, distributions are again, some drugs are getting protein bound, some are not. Then next is they are excreted. Now each drug, there is a different time for absorption, for distribution, for metabolism, for excretion. Some drugs are rapidly excreted, some drugs are less rapidly excreted, and therefore half-life of each drug is different, okay. Now if it is much different, if some drug is half-life is 4 hours, some drug is suppose 6 hour or 7 hour, then what will happen is the another, either one drug will lose its effects और वन ड्रग विल गेट एक्यूमुलेटेड. जिसका 7 आवर था, अगर मान लो हमने 3 टैबलेट्स अ डे सोचा है, सो एट एवरी 4 आवर्स वी आर गिविंग, वन इज मॉर्निंग, then one is in afternoon, one is after in the evening, that in that case those which is having 7 hour half life will be accumulated in the body because time course is not same. So whenever fixed dose combinations are done, it is very important to see that whether their pharmacokinetic features are same or not. Altered renal or hepatic function of patient may differently affect the pharmacokinetics of the compounds. Again, in that case what happens is, suppose there is a renal problem, so and drug A is excreted by kidney, so it will be accumulated. We have taken it as per the normal situation. Or if there is a hepatic problem and drug is metabolized by liver, then that drug will not be metabolized properly, it will accumulate in the body. So because of either renal or hepatic function problem, there can be accumulation of drug A or drug B. Maybe suppose while combining, people have seen that they have both have same pharmacokinetic feature or same half-life or near half-life. One is having suppose 4 hours and another is 5 hours, so it is acceptable. But now if it is one by renal, one or excreted through kidney, another is metabolized by liver, then in that cases that will be altered, the half life will change. Now in that cases one should be aware about it, and then fixed dose combination are useless, because you have to modify the dose of the compound which is either excreted by kidney or the compound which is metabolized by liver in the cases of renal or hepatic function problems. Then adverse effects, when it occurs, cannot be easily ascribed to the particular drug. Particularly both are having similar kind of action, and if it is a type A type of adverse reaction, then it cannot be exactly told that which drug might have caused it, and then it is difficult to think about to change or how to change it. Then contraindication to one component contraindicates the whole preparation. अगर उसमें एक ड्रग ऐसा है जिसको किसी को एलर्जी आ रही है, तो वी कैनॉट से कि एक ड्रग नहीं देते अब इसमें से, बिकॉज इट इज़ मिक्सड इन द टैबलेट. So one has to remove both the drug. We have to stop both the drugs in that case. The confusion of therapeutic aims and false sense of superiority of two drugs over one is fostered. That is actually, this is the major reason why these are used. So when this is combination, and the companies, they train their medical representatives, they try to convince the doctors that since drug A and drug B, which were better individually, when they are combined, the effect will be very superior, and therefore this will cause very, very good effect, and therefore they are forced to use, or they are just using it in that way. And it should be avoided, because it can give a false sense that they are really very better. Many times they are not actually better, many times they are rather not advisable, and still these preparations are existing in the market. Because what happens is, pharmaceutical companies, to stay in a market, to have a bigger say in the market, they try this kind of things, and they try to force doctor that, see, no company is making such kind of dual preparation, we are making this, so that means we are better than other people, and this is the preparation, because of this combination this is very beneficial. So because of this kind of impression they are putting on the doctor, they can cause such impression, and unnecessarily patient will be suffering from that. Corticosteroids should never be combined with any other drug which are meant for internal use, because we have seen corticosteroids, their dose has to be tapered. Then many times they causes immunosuppression. Because of that, they are responsible for chances of infections, and therefore they are not expected, they should not be combined as far as possible. So these are various factors which are influencing, which the pharmacologist or the pharmacotherapeutics or the doctor should be aware about, and that care has to be taken while prescribing or going through the prescription, or while guiding the patient through it. They are very, very important, because drugs, although they are beneficial, drugs, although they are very, very useful, but they can cause a big harm to the patient. There are chances that there are incidences that at many places around not less than 10 to 15% patient may die because of the wrong use of the drug, or because of the adverse effects of the drug. So this is not a good thing. Why? Because it is all stated everywhere that the important thing is, there should not be harm to the patient. We are doing for the benefit of the patients. So if we are not aware about that, how we can give the benefit, then we have no right to prescribe any drug. And therefore every person in this area should be aware about how various drugs are there, what can be their benefits, how there can be problems, how we can avoid problems. So until and unless we understand this mechanism, we cannot understand about their difficulties. So here we finished important topic, that is factors influencing drug action, and